Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series 63. RNA is nothing but random questions in neurology and neurosurgery with answers given by Dr.K Gireesh, that's myself. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning, and also for public awareness. In this series, the question that I am addressing are what are the stages of the brain abscess, various stages of brain abscess, and the pathological and the radiological features. Now, in the Journal of Neuropathological and Computed Tomography Findings in Experimental Brain Abscess, published in the Journal of Neurosurgery 1981 by Britt et al. It is given as early cerebritis, late cerebritis, early capsule formation and late capsule formation. Early cerebritis is the 1st to 3rd day. The late cerebritis is 4th to 9th day. And early capsule formation is 10th to 13th day, and the late capsule formation is day 14th and beyond. So, early cerebritis, the late cerebritis, early capsule formation and the late capsule formation. The onset and duration of each of these stages is not absolute, and it can be altered by the antibiotic therapy, administration of corticosteroids, and alterations in the immune status of the host. Now, in the early cerebritis, the duration is 1 to 3 days. The pathology is a patchy focal necrosis, non-encapsulated edema and hyperemia. That's the early cerebritis. The CT findings, hypodense with a poor ring formation with contrast. The MRI findings, T1 weighted hypointense, T2 weighted hyperintense. And the contrast enhancements, patchy enhancement will be seen. In the late cerebritis, the duration is 4 to 9 days. The pathology is central necrotic area with pus formation and severe edema around it and poorly organized fibroblast network. The CT findings, ring enhancement with the diffusion of contrast into the hypodense center on the delayed contrast. The MRI findings, T1 hypointense center with an isointense rim. T2 you find hyperintense center with a hypointense rim, and contrast enhancement, there is a peripheral rim enhancement. Next, the early capsule that forms nearly 10 to 13 days. The pathology is a necrotic center with pus, thin rim of fibroblastic capsule with thinnest area on the ventricular surface. The CT findings are a well-defined ring with less diffusion of contrast into the center. And MRI findings, T1 weighted, you find a hypointense center with an isointense to hyperintense rim, and T2 hyperintense center with a hypointense rim, dual rim sign. And the contrast enhancement, there will be a central enhancement in delayed contrast with a peripheral rim enhancement. The late capsule formation, duration is almost 14 days plus. Pathology, necrotic center with pus, thick collagen capsule and edema around the capsule and gliosis. CT findings, well-defined ring with no diffusion of contrast into the center. The MRI findings, T1 hypointense center with a thick hyperintense capsule, and the T2 weighted will be a hyperintense center with a hypointense thick rim. No central enhancement with contrast, a thick enhancing capsule will be seen. That in fact is the pathological and radiological features of these 4 stages of brain abscess. The early cerebritis, 1st to 2nd day, 3rd day, late cerebritis, 4th to 9th day, and early capsule formation from 10th to 13th day, and late capsule formation from day 14th and beyond. Well, I'd like to say once more or reinforce the onset and duration of each of these stages is not absolute and may be altered by antibiotic therapy, administration of corticosteroids, and alterations in the immune status of the host. So, the other worthwhile the literature audience are Martinez. In fact, diagnosed the brain abscess by MR spectroscopy, report of 2 cases in the Journal of Neurosurgery 1997. The other 2 publications by Wellen et al. In the publication Radiology, CT as a guide in the diagnosis and follow-up of brain abscess. Yang, yes, a lovely article 1981, review of a brain abscess of 400 cases. These are worth reading. Thank you very much.